Next, we're going to talk about lupus. We're going to talk about lupus, very quickly because it's not something that we necessarily see a lot, nor is it a disease process usually that people are actually hospitalized for, so it tends to not be something that you're going to take care of someone. They probably could be admitted for something else, but lupus would be in their history. It's on page 1582. Okay, lupus. So lupus is another chronic inflammatory disease that can affect almost all body systems. Usually affects primarily the skin, the joints, and the kidneys, but it can affect all. It can have periods of exacerbation and remissions, and the deal with the exacerbations is they are typically brought on by something. And so people with lupus need to kind of keep an eye on this and identify what could be causing their exacerbations. So as far as lupus, it usually starts out with the person has arthritis, develops the rash that you guys are seeing on this other side of the page, weakness, fatigue. Then they go to the doctor and they talk to them about the different signs and symptoms that they're having. You guys can see additional signs and symptoms on page 1584. Then they actually have to try and make a diagnosis based upon the history that the patient has given them, the exam. And what we realize is that no one diagnostic test says you have lupus. The lupus antibodies actually are really only present in 30 to 40% of the people. ANA is usually high or positive, but in 95% of people, but it can be high for a lot of different reasons. And so you can see that it can be difficult. The ESR is typically elevated, but it can be elevated in others. There could be maybe some anemia involved, and if the kidneys are already involved, maybe some changes such as maybe some blood or some protein in the urine. So it's difficult to piece together, but once they do piece it together, then there are some medications and certain lifestyle changes that people with lupus need to make. Okay, let's finish up lupus. We're on page 1584, and just remember, lupus is not curable, so we often just treat the symptoms of lupus, and the disease can have periods of exacerbation. So a lot of times we're just treating the body system that is involved. So for instance, a lot of times the person will have joint pain, and when that's the case, if they have joint pain, NSAIDs. So everything that you guys know about the NSAIDs. A lot of times for the fatigue, the tiredness, the skin and joint problems, they'll use anti-malarial drugs, and a very popular one we talked about with rheumatoid arthritis is Plaquenil. One thing I didn't mention is if someone is started on Plaquenil, then they have to have an eye exam before it's started, and then every 6 to 12 months once therapy is initiated, because it can cause a retinopathy. As far as steroids go, if there's a severe exacerbation, they can use steroids, especially if there's really bad arthritis. But they try, obviously to stay away from the chronic use of steroids. Kidneys, a lot of times they're placed on an ACE inhibitor early on. It's a protective factor. Otherwise, if the kidneys get involved, they can end up on dialysis and needing a transplant. As far as nursing care, that is relevant. You just have to kind of focus on the system that is involved. There is a chance if it becomes or attacks the brain that they could develop seizures. Probably when I'm looking at this, realize that probably the number one nursing diagnosis related to lupus would be fatigue. Many of them experience fatigue. It's because they're in chronic pain, have inflammation, altered immunity. So this is an individual, as we talked about with rheumatoid arthritis, they have to have rest periods, put the important things of the day first, space things out. Also impaired skin integrity because they might have the discoid lupus where it's the rash. And so we have to remind them that they are photosensitive and that often being out in the sun intensifies or makes the rash worse, and so they have to wear protective gear, protective clothing, lotions at all times. Ineffective protection would be because their immune system is altered. And then impaired health maintenance would be because they have multiple things that they need to do in their life because they have a disease process that alters many different bodily systems. And that's it for lupus.